My name is Richard Kowal, and I'm a chiropractor practicing in New York, and this is my 40th year of practice. I'd really like to recommend to any practitioners, chiropractors, PTs, physiatrists, who are interested in treating peripheral neuropathies, that they get a Stimpod. There's nothing else that you have in your quiver that's going to treat neuropathy the way Stimpod does. It's exciting to have a distinctive capability, to be able to treat patients that other practitioners can't treat because they don't have this modality. When you work with Stimpod, you end up, as a consequence of using it, learning more about peripheral neurology, the anatomy. The benefit that I'd received was a strengthening of a leg that had weakened because of a lumbar disc problem. That's how I first looked at Stimpod, as a device which could conceivably help people get strength back into a limb that had lost strength because of neuropathic weakness. So I got a call from an orthopedic surgeon that I work with, and he said, "Have you had any experience working with foot drop?" This patient came in, and I looked at this patient as someone who had a much more profound, much more severe version of the weakness that I had in my left leg, which was mild by comparison. I treated him once a week over the course of the next 5 months. And it was a case where he was able to regain 100% of the lost function. So his foot drop completely resolved, which was really quite exciting. It was exciting because in the past, if I had been offered the referral of a patient with foot drop, I would just say that's really outside the scope of my practice. So I had expanded the scope of my practice. Super exciting. This was a device that was outside the scope of insurance reimbursement. So not having CPT codes, not being an insurance reimbursable service, it represented kind of a premium service. This is not a matter of having a better treatment for conditions that you already treat. This is a device that will let you treat conditions that you couldn't treat in the past, and it makes a significant difference to a practice. Now I've just begun to treat neuropathies of the feet using Stimpod. Problem I never treated in the past. I never would have asked for that referral, and I'm beginning to get great results. People are finding that within 5 treatments, they're often 50% better. So I can charge a premium fee, deservedly, because they know I'm treating peripheral neuropathies with the Stimpod device. And it has changed the bottom line of my practice. I do generate a significant amount of income as a result of being able to use this premium treatment. And I'm excited about it going forward. I feel like even though I've been using it for 3 years, I've just scratched the surface with what's possible using the Stimpod.